Hello, welcome back. Today, finally, what we call a results policy or drug rationalization will be proposed. Let's start with the definition of this, with what should be its purpose. For this we use the teachings of Professor Dr. Ronaldo Laranjeira, PhD from UNIAD, in his work Legalization of Illicit Drugs in Brazil, in Search of Rationality Lost, which can and should be addressed at a global level. According to Laranjeira, a drug policy based on results and not on rhetoric and ideological debate should be judged by its effect on reducing the social cost of all drugs and not just a specific drug. The best social attitude would be one upset tolerance towards drugs, without ideological fervor, but with a sharp and persistent pragmatism. We run the risk in Brazil that the drug legalization debate will hide the real issues related to a rational and balanced drug policy. We could spend years in an unproductive ideological debate where people will argue for or against the legalization of a specific drug with great passion and little information. He continues, the challenge of the drug debate in Brazil is not whether we should relax marijuana laws, but how to have an informed debate with data, and produce a rational and balanced drug policy that can be constantly evaluated. The implementation of this policy does not occur spontaneously, but with determined government action. Perhaps it is useless to wait for a major national drug policy. Local government actions could make a big difference. States and municipalities should get involved in these actions with community help. Civil society is already quite mobilized on the issue of alcohol and drugs. It is now necessary for democratically elected governments to show their ability to organize a rational response to a problem that affects millions of Brazilians at an enormous cost to the country. Well, now, using a metaphor, I leave you with the first question: if you had to catch some rats, would you run after them? Would you use force? Poison with the possibility of harm to third parties? Or some simple mousetraps, with huge, juicy pieces of cheese attached to them? Leave us your comment and help us with this reflection. While we're at it, we're also going to answer a question that appears repeatedly when dealing with this subject: why doesn't the search for the drug that generates this terrible demand, end? If there is no one to buy, there is no one to sell to. It's not possible on this side of the coin. Remember the first step we discussed here on the channel? If you don't remember or haven't seen the video, don't miss it. It's crucial. Follow us. The correct question would be, why don't we put an end to trafficking, the drug trade that generates this terrible supply? If there is no one to sell, there is nothing to buy. This is where in a policy of results the figure of what we call the trafficking state must appear. Imagine a marble falling from a starting point, traveling along an absolutely smooth surface, towards an end point. Now, imagine this same marble, traveling across a surface full of obstacles, like a maze. Which ball would reach the end point first? The state should not be a trafficker. You must act like him, use your cunning to get closer to the user, but unlike him, create obstacles to the inevitable fate of the marble. We're back to the previous video. If you haven't watched it, watch it on the channel at Minister by Chance. Once the stage of decriminalization of the use of all drugs has been overcome, since the state could not make available something that it itself criminalizes, in terms of trafficking, what we could call a domino effect would inevitably occur. There would be a lack of interest on the part of the drug dealer himself in not wanting to compete with the state, not because of decriminalization itself, nor because of the fact that conduct that harms public health is still considered crimes, but because of the lack of profit. Along with the decriminalization of use, the specific crime of trafficking simultaneously loses its reason for being and ceases to exist. We are not talking about an abolitio criminis, but, at most, a novatio legis in melius, where crimes already classified against public health would apply, due to violation of the determinations of the public power, the only one authorized to deal with such substances. As said, due to the lack of interest, technically, at this point, this would occur for reasons of criminal policy. Furthermore, in relation to the traffickers considered most dangerous, the population would not have the displeasure of seeing them free, as they will certainly continue to be responsible for crimes related to drug trafficking, such as homicides, rapes, gang formation, corruption, money laundering, arms trafficking and countless others. However, there would be an undeniable and necessary extrication, using the indispensable alternative sentences, for those traffickers known as bocas, mules, vapor, who overcrowd the prison system, cause its bankruptcy, and in general, they end up being recruited, perfected in the world of crime, serving heavy sentences in the place of the real drug kingpins. From the user's perspective, the state, as stated, must approach the vulnerable and carry out active prevention, recovery and social reintegration work, that is, it must be present in all phases of the individual's iter victimi and, with this, try to interrupt your own path as a macro-victim. Note that the state cannot tolerate simple trade with these characteristics. Some mistaken decriminalization theses, among other serious mistakes, create a highly bureaucratized system, passing on to the private sector what is the duty of the state, with authorizations, licenses, other permissives, resulting in fraud, crimes of the most varied types, making supervision difficult. Making it excessively costly and discreditable to remain regularized, also promoting a parallel illegal market, even more harmful to society, as occurs, for example, in Uruguay in some American states. Thus, the state or government has the duty to directly assume that exploitation of this economic activity, meeting the imperatives of national security and relevant collective interest. Note that the state already has a constitutional obligation to control and supervise the production, transport, storage and use of psychoactive substances and products. With the implementation of a results policy, the public power leaves its position as a mere inspector and becomes an integral part of this process. When assuming this control, the state, as stated, must create obstacles, layers of negative interventions to use, unlike the drug dealer who does everything to make the individual consume the drug. Anyone who doubts just goes to a nightclub, turns a corner. But don't worry. You can sit there in your armchair and they will deliver it to your home, by mail, just place the order by phone or online. They accept all forms of payment, including threats, beatings, kidnapping of family members, or if you prefer, you can pay with your own life. Undeniably, this is an inverted system. The more force is applied, the greater the distance between the public power and the user. A true, well-trained martial arts fighter, when attacked, uses his opponent's own strength to defeat him, that is, he is not the attack, as it may seem at first glance, he is the defense. The first of these layers, directly related to the danger of the victim, watch the video O Caminho de Victimização on the channel at Minister Bychance, is prevention. Here again we will use the teachings of Professor Laranjeira, who brings us the idea of the so-called control and inhibition mechanisms for use. Making a simple comparison between harm reduction and results policies, we understand that these mechanisms also found in the first policy must be readapted and/or replaced by other mechanisms of equal or even greater control and inhibition power. As an example, in relation to the stigmatization of use, in harm reduction the user is seen as a delinquent or consumer, in results as vulnerable or disabling. In relation to fear of illegal activities, in damage reduction apparent fear of the state-given impunity, false sense of security brought by the norm, disorientation of the public power, facilitation or normalization of use, in results real and constant fear of society, of inability caused by the drug to interfere in their civil and political acts. Regarding the effects of prohibition on harm reduction as confusing and illusory, where the correct use of these substances is encouraged and at the same time their use is prohibited, it sharpens the curiosity of the most vulnerable, fosters a situation that can be seen as a challenge, the known, forbidden fruit effect, whereas the effects of the restriction on the results would be moral and therapeutic, with greater social reprehensibility, applying criminological theories such as the labeling approach, symbolic interactionism, labeling or social reaction, and awareness the severity of something disabling or self-limiting. In fact, the strong point of this proposal, perhaps its first and biggest obstacle, must be, precisely, the awareness of society in the diligent work to prevent drug use. Remember, unlike the drug dealer who runs vast and diverse campaigns for use. But how can we seek out all this breadth without forgetting the different regional factors of each location? How to change the victim's understanding of the drug problem? Again we have to think like the victim, that is, how she would most easily assimilate these new ideas. Many say that it is impossible to have a large social mobilization, that the public power is unable to penetrate many areas of our country. But why doesn't this happen when it comes to the World Cup? Has anyone ever heard of what in sociology is known as mass control? And the Brazilian voting system using electronic ballot boxes, how does it manage to bring the vote from those riverside dwellers in northern Amazonia by canoe? The Portuguese example in the creation of a national integrated response plan, which consists of selective intervention strategies with regionalized information, would help a lot in this regard. But that's not all. In the case of drugs it is necessary to combat it with an aggressive campaign, linked to things that the victim likes to do or that they have as a priority, such as the birth of a child, what gives them satisfaction and, consequently, shock her, traumatize her, making her think, worry, become aware that it is something serious, as it transcends the sphere of the individual, and does not want that for herself or her family, even though they must be posed the inherent benefits. That will result from modifying their behavior. Terrorism is not being proposed, but reality and adequate scientific information. Nothing very new, as the Ministry of Health, already within this more energetic line, using what gives the smoker the most pleasure, the addiction itself, ordered cigarette manufacturers to print photos with phrases on the back of each product package. Warnings, images of extremely weakened people, pieces of organs destroyed by addiction, insinuations of sexual impotence, and an infinite number of consequences that the use of this substance can bring. But pay attention again. It's not just informing her. We need to delve deeper and look for alternative ways to provide them with pleasure. The adrenaline stimulated by intense activities is a good example. However, a priori and best prevention originates in the family. This, like the state, must also approach the vulnerable, but much earlier, preferably from an early age, and carry out active prevention, recovery and social reintegration work, that is, it must be present in all phases of the process. Victimy of the individual and, in doing so, try to interrupt his own path as a micro-victim. It works more or less like this: the user uses the drug and whoever feels its effects, its consequences, is the family. She has a natural obligation to feel. If you don't feel it, it's because something is wrong and it's up to the state, under the terms of its constitution and infraconstitutional legislation, to fix it. It is undeniable that every individual seeks a behavioral reference, negative or positive, starting with their origins. If she is still unable to avoid this situation, once the layer has been overcome, the obstacle of prevention has been overcome, her obligation continues. Now she also needs to try to stop all the victimy phases that for some reason she couldn't avoid. Who better than the family to contain the user and assist the state, and vice versa, in monitoring and obtaining information from the user, in what Brazilian drug legislation calls shared responsibility? Well, at this stage of greater family intervention, it is necessary to distinguish between recreational or occasional users and drug addicts. Recreational or occasional user corresponds to an individual who is still conscious and has self-determination. This user was adequately compelled not to use drugs by family, society and the state, by a multidisciplinary team, and, even so, he chooses to use the drug. His free will, with scope in the theory of imputability, where man is an intelligent and free being, able to choose between good and evil, between right and wrong, and therefore responsibility for actions can be attributed to him. Crimes he committed, resembles that of a suicide. Brazilian law, as well as other countries, does not punish attempts, much less suicide, nor could it. When looking for one of the pads, more detailed below, the user presents their identification document, goes through the multidisciplinary team, where they must be evaluated and persuaded not to proceed, and persisting in the purpose of obtaining the drug will have it in a controlled portion. Thus, compliance with the principle of non-interference in the individual's private sphere will be overcome, but, as stated in the previous video, other legal relationships established by the user must be the responsibility of their respective legislation, civil, administrative, labor, tax, traffic, in short, and then we can talk about zero tolerance, closing the siege. After all, repeat, one must always treat unequals unequally to the extent that they are unequal. What if this user is a teenager, the favorite target of drug traffickers? Note that if the family is contacted, this teenager will be cornered and under no circumstances will he look for one of the pads, he will prefer to buy the drugs from the dealer. Now, why is this target so fawned over by traffickers? He is young, generally a student, goes through a whirlwind of physical and mental transformations and values, above all, what they call independence. The person at this stage of life is the one who needs guidance the most, not just from their parents, they are too stupid. They need self-affirmation, which in the vast majority of cases do not accept or disregard the family reference, translating it to the infamous groups, urban tribes, propelling a false sense of less social rejection and of their own self in training. Criminally, these individuals are known as unaccountable. They do not have complete mental development or satisfactory self-determination. Their incapacity makes them extremely vulnerable and malleable, and it is precisely at this point that criminals operate. Why not learn from them? However, this cybernetic incapacity in no way compares to those of old roller cars. Furthermore, it is necessary to clarify that the vast majority of young people do not use, nor are they likely to use, these substances. When a teenager seeks one of the pads, the responsibility of the multidisciplinary team must increase significantly. This team must act as or more effectively than the trafficker in manipulating this individual, obviously against use. However, the fact that this human being is a teenager does not take away his power of choice, which, even though it is incomplete, exists here. The role of the multidisciplinary team, already at a level that could not have been achieved, today this young man would be in front of a drug dealer about to acquire the drug, is simply to fill in, complement, what they lack due to their incapacity. If you still choose the drug, you will be treated with even more controlled doses. After all, don't teenagers get sick? Unfortunately, the ideal would be for this not to happen and, it should be noted, the time for half measures is over. It is also worth mentioning that unfortunately there are many parents who encourage and support their children, from a very young age, to use the most varied types of drugs, legal or not, out of ignorance, perhaps, or because they are also users of these substances. This is what healthcare professionals call facilitation. This is criminal conduct. Without prejudice to the suspension or loss of family power. The work of the multidisciplinary team is exactly the opposite, that is, to discourage use. Its purpose is to treat the user, in a last attempt to save him, after a whole process in which the main weapon is prevention. If everything goes well, these individuals will never come into contact with drugs, nor will they even look for one of the paths. Chemically dependent user, at this critical point, realize that the distinction between adolescent, adult or elderly loses importance, given the degradation of human beings, the total loss of their dignity. That little bit that needed to be completed now no longer exists. Everything revolves around drugs. The drug could be inside a toilet that he goes after. Family, friends, neighbors, everyone is already aware that this individual needs help. The drug addict, after obtaining a controlled portion of the drug, has no idea that his family will be promptly contacted. The legal guardian of this dependent must receive specific instructions on how to deal with the situation, being warned about their responsibility, a kind of warning. When the addict repeatedly tries to obtain these substances from pads, the person responsible must be contacted to immediately appear at the unit where the addict is located, under penalty of an administrative fine, without prejudice to their criminal liability. When arriving at the designated location, after having spoken to specialists, the person must take one of the following three options. First, take the dependent home. In this case, municipal health agents and/or accredited volunteers will carry out periodic visits to your home, providing real monitoring and issuing reports. If the reports from municipal agents recommend it and there is approval from the multidisciplinary team, the patient will be admitted, subject to judicial authorization, even against the will of his legal representative, who will, consequently, be held civilly and criminally responsible. This hospitalization is called compulsory. Second, obtain voluntary hospitalization. Third, authorize involuntary hospitalization. If there is no person responsible, the public prosecutor's office is the one who must promote the interdiction of the incapacitated person. You will be appointed a special curator, and, if applicable, with his or her authorization, referred to one of the CTs, further detailed below. Repeat, the time for half measures is over. It is important to emphasize that even after treatment or hospitalization, no matter how good it may be, there is, to date, no possibility of completely eliminating any relapse of this rehabilitated person. For this reason, there must be perpetual policing of the state, society, family, and the user themselves. Therefore, she must still attend periodically, gradually, the unit in which she obtained her recovery, or if done in a private clinic or abroad, in any unit, for reassessments of her current state of health, under penalty of loss or suspension of their political rights. Just like diabetes and AIDS, the individual does not obtain a cure, but simply must learn to live with it. Furthermore, back to the idea of shared responsibility in Brazilian law, it is extremely important to raise awareness and direct participation of the citizen, of society as a whole, as a macro-victim who is represented by the state, that is, not waiting for the state to do it, but do with him. Everywhere there is a residents' association, we have community leaders, fundamental people in this process who know like no one else what their real problems are, their biggest difficulties. In the example of Brazil, the Brazilian people are fair and supportive, they have creativity, they have a Brazilian way for everything. NGOs, as well as a large part of the private sector, have worked in partnerships with federal, state and municipal governments. Today we only talk about Facebook, Instagram, Twitter, WhatsApp. There is an entire virtual community of millions of followers, which has strength, a huge field of activity. For example, why don't we create the figure of a virtual, social inspector? Any citizen, after registering on the National Anti-Drug website, would act as a kind of event promoter. Through its internet community, it would try to raise the largest number of donations for this project, and it could provide technical information to its followers about the harm that drugs bring. Furthermore, it would maintain direct contact with the Ministry of Health, providing all types of information, that is, everything that happens on social media. It could also be called upon by public bodies and entities to bring together volunteers, organize joint efforts, such as the one carried out in Chile, where dozens of popular houses were built by young university students to house thousands of needy families, produce events, marches, suggest actions, projects, campaigns, as well as the allocation of the resources they raise. And best of all, without leaving home. The advantages of being a tax would be the granting of tax benefits by the government, obtaining prizes and promotions, a cost allowance for those who accumulate more points, discounts in bars, cinemas and restaurants, in addition to the fact that they are carrying out social work of mutual cooperation. As we said in the video about the fragmentation of drug policies around the world, if you haven't seen it, check it out here on the Administrações channel. Taking Brazil again as an example, it has its own peculiar way of being, just like every country in the world. Therefore, care must be taken when adopting as a rule how other countries deal with the problem, but the entire structural idea of a rationalization of drugs proposed here must, necessarily, be the same. When we refer to public health in Brazil, neglect is evident. How can we claim full, sustainable development if we do not treat public health as a priority? This understanding is primary. How can a citizen hope to have education, work, housing, and countless other things, if he doesn't have health? If there is no life for it? A Brazilian results policy, as a good example for the world, as it is a continental, regionalized country, rich in diverse peoples, cultures and religions, cannot create a specific system to take care of the user, as unfortunately not even the general system has treated their patient with a minimum of dignity. What will be said about the specific? When created, all mechanisms must always seek to benefit the system as a whole, as the results policy must be part of it, a true integration. Inevitably, they will need to be reused in the prevention and treatment of patients with other types of pathologies. All efforts and resources obtained, even if indirectly, must be directed towards public health in general. Thus, among the various and necessary changes, always preserving what already exists and produces satisfactory results, for example, it would be the unification of subfolders in the three spheres of government, municipal, state and federal, linked to the Ministry of Health and directly connected to the other in the WHO to standardize and maintain the focus of action, with mutual cooperation, with a great integration of its bodies and entities, in a hierarchical, regionalized and decentralized network of activities, in fact, how the SUS in Brazil. Regardless of the policy adopted, the command must be unique. Possible to have decentralized action. Another important modification would be the creation of what we call decentralized action points or paths. The paths, which must be present in each municipality, would operate in stands, those used in community action programs. The purpose is exactly to extend the medical and hospital treatment units that already exist. A multidisciplinary team, made up of several professionals, interns and volunteers, must be formed to work at these stands, with the firm purpose of identifying, registering, mapping, starting a treatment, even without the user noticing, as a last resort administering controlled doses of these psychoactive substances so that the user naively thinks that he is obtaining the drug without major compensation to the state, and with this, as said, getting closer to it. They must also notify relatives on specific occasions already mentioned, and, when applicable, refer them to the treatment centers. The CTs must be public or public-private, environmentally friendly clinics, which must be created along the lines of an American supermax, but adapted, obviously, for the treatment and recovery of drug addicts. Finally, the reality is that it does not matter what policy in the world you intend to adopt if you do not plan and, above all, guarantee and implement all the social rights of citizens. It is perfectly understandable that decades of failures and omissions are not remedied in a few years of a government. We just can't admit so many more decades. Just look at the example of Colombia, which has undergone significant social transformations in recent times and, even without rationalizing drugs, has already managed to change the lives of many people. But look, what at first seems absurd, a trafficking state, nothing discussed so far can be seen as new on the global drug policy scene. In some policies, adjustments will only be necessary, smoothing out some rough edges, observing details that make the difference between success and error, between life and death. Remember the fifth step we discussed here on the channel? Here's the first mistake. If you don't remember or haven't seen the video, don't miss it. It's crucial. Follow us. Let's take as an example the policy applied in Switzerland, in the infamous safe consumption rooms and assisted injection rooms, where there is drug consumption supervised by health professionals. Also as an example, right here in Brazil, we have the Farmácia Popular program, an initiative of the federal government, which aims to offer a variety of essential medicines, some available free of charge, while others are offered with discounts that can reach up to 90% of the price. Market, through accredited pharmacy networks, which can be both private and public establishments, with the individual only having their CPF and/or medical prescription at hand. Did you notice anything familiar with the proposed results policy? Subscribe to the channel, leave your like, your comment, share.